Well, hi all. This is Sushant Grover, business head Dr. Bhatia Medical Coaching Institute, and it's rather a pleasure to have Dr. Manasvi here. Rank 3 2016 May AIIMS. Dr. Manasvi, first of all, congratulations.
Thank you
so
very
many
much.
congratulations. You secured rank 3. First of all, what exactly it feels like to be a rank 3?
Well, there's nothing like feeling type. It's like it feels very good. You feel relaxed, satisfied with it. Like you work hard for such long time and then you get such good results. So you ultimately you feel on cloud 11 actually.
Not on cloud 9, it's 11 now.
11.
Okay, that's great, that's great. So to start with, the very first point, for everybody's success, there is someone behind that person, their parents, mom, dad, brother, or some teachers or something, like, to whom you give you all your credits.
My all credit goes to very amalgamation of people, my parents, my family, all my friends, my senior, juniors, colleagues, all my teachers who have taught me all through these 5.5 years of my college life. I am from Lady Hardinge Medical College. I am proud to be an Hardonian. So all of them have taught me and played a very important role in helping me achieve my dream, achieve my goal. So I owe everything to them.
So again, amalgamation of people, credit goes to all. Okay, right now you are sitting in studios of Dr. Bhatia Medical Coaching Institute. How did we help you to reach your aim?
I joined Dr. Bhatia Medical Institute during my internship. I did a TND from here. The TND of Dr. Bhatia is actually very good. A lot of people give this are actually a part of this TND. So the ranks you get are actually insight of where do you actually stand in the entrance examination. It gives you an insight of where do you in what direction your preparation are going. And the teachers of this institute are really good. They teach you in a very crisp, lucid manner. And the tests are like that. They give you all the potential new questions, the important questions which are going to be asked, which can be asked in the examination. So that is a very good point of the TND, and I was quite satisfied with the TND. Plus, along with this, I gave the online test series of Dr. Bhatia Medical Institute. I made a point that I give at least one test every month. So of every subject. So it covers like every subject test and discussion actually covers like all the points, all the important topics, which you can go back and look to your standard textbook, read that particular question in which you actually made a mistake from your textbook. So that really helps.
Any particular subject or any particular faculty you were very focused and you liked the most, or something like, the favorites one, this subject was my favorite one too when I joined the TND or when you attended our classes or something like?
Surgery and medicine were my favorite one, along with the minor subjects like psychiatry, orthopedics. I guess 4 of these my favorite teachers.
Chaliye, theek hai. You have explained me just now before the interview that some books was very important during your whole time of studies and all, which helped you to reach this aim. Any particular book from our side which helped you?
I read Medical Essence by Dr. Bhatia. I guess the book is really very good for medicine. Actually, I read only that book for medicine. It gives all the important points in red boxes, which are the important points we need to focus on, and all the new drugs which can be asked in examination are given in that book. Plus all the topics like infectious disease, which you actually cannot read Harrison in your internship because it's very bulky books. So you can actually refer to this book. It gives you like an overview of Harrison, and it's very good and crisp and very good to revise before the examination.
Any specific words for our test series or online test series? Like you already told us that you have given a test in a month. Any specific words for that?
I guess the online test series is very good for Dr. Bhatia Medical Institute because a lot of people are actually giving it. Like it's not like only 10 people give it, 20 so you get a 1 rank or 2 ranks, so you feel very happy. Like thousands of people are giving it. Plus the test questions are very good. It's not the simple questions. They are like tough, all kind of questions they cover, all the difficulty levels they are covering. So you get a rank where you actually decide, okay, I'm standing here, so I have to work hard. So you actually can reflect that in your next test. You can work hard for that subject. Plus the questions are very good. So I advise my juniors to join the test series.
Can you explain, just a question of AIIMS. what exactly were you thinking about that particular question? If you can recall any question, and you can explain to our students, or might be the people will be seeing us from our YouTube channel or Facebook. Can you recall any question that question particularly stuck you up, and how you exactly solve it, just in a brief?
Like AIIMS examination, I guess whoever has appeared in AIIMS examination knows this fact that the pattern examination has completely changed. It is nothing which is put up from your previous 10 years, and the same questions are not repeated in this examination. It is more of a practical based and clinical based questions over there, more of histology slides and more of picture based questions. So it is very important for us now to focus more on our standard textbooks, especially Robbins and your anatomy diagrams. You have to go back to a standard textbook, at least have a look of all the pictures. Plus, it was something when you appear for an entrance examination, very important is that you should take every question as a new question. If you stuck up at one question, you must always think if it's a difficult question, it's difficult for everybody, not only for you. So that is very important. Plus, when you go to the next question, leaving that question, then you should take that question as a new question. Forget about the previous question. So you should not take a stress during examination, because if you think you are stuck up at one question, you should have that something in your back of your mind. Everybody is going to stuck up at that question, because the difficulty level of paper is such that at least 50% of questions are very easy and 20% of questions are very difficult, which nobody can solve in the whole of India. So that is very important, and you should not take stress during that time. You should stay calm, keep your cool, and attempt the paper like with intelligence, problem solving technique by eliminating options. That is very most important.
Again, that is why in my just by starting that interview, that is why I told everybody that it's a pleasure and honor to have you here. Because the way you explained it, I think everybody should understand the same funda, I think, which Dr. Manasvi have explained. Okay, now we are gonna end this interview by asking the very last question for your juniors. Any sort of a guidelines, any sort of a help, or any sort of a message you want to give your juniors to come and prepare for May AIIMS? Any messages?
For my juniors, just want to tell, first of all, you should not take the stress of a competitive examination right from your first years or second years. Those are your formative years of an MBBS curriculum, where you should actually stress on your basic subjects like anatomy, physiology, biochemistry. You should utilize that time of first and second year to to build your base. You should read the standard textbook as much as you can and with efficiency, rather than running after coaching institute for notes. Secondly, I just want to tell that you should during internship and your final year and third year, you should focus more on your clinical posting, because as we have seen, the pattern of examination actually changed. They are asking more of a clinical question. It's very important for you to focus on each of the clinical subjects like surgery, medicine, attend the postings, learn new things, learn the practical aspects of things which cannot be taught to you by cramming up textbooks or MCQ books. Thirdly, it is very important that you should now focus more on picture based questions. You must see the diagrams of all the standard textbooks before going for the examination. Fourthly, very important, last but not the least, you should have belief and faith in your abilities. It is only you can do it, and the competition which you have is only with yourself, not the whole of the world. So you actually have faith in abilities, and then everybody, I believe, if they follow these, they'll come out in flying colors.
Exactly. The way we say that, believe in yourself and you can have everything you want and everything you need. Again, Dr. Manasvi, it's a pleasure to have you here. It's an honor to have you here, and we are very happy that we've been associated with you in your success. Thanks a lot.
Thank you.
Thank you. This is me, Sushant Grover, signing out. Thank you.